Hey everyone, Nurse Jen here. If you're a military family raising a child with special needs, there's a program you may have never been told about, and it could change everything about the support your child receives. It's called TRICARE ECHO, and today I'm going to walk you through what it is, who qualifies, and what it covers. ECHO stands for the Extended Care Health Option. Think of it as a supplemental program that sits on top of your basic TRICARE coverage. Basic TRICARE covers a lot, but for children with significant disabilities, there are needs that go beyond standard coverage, and ECHO is designed to fill that gap. This is something I've worked with directly, and most families have either never heard of it or they've heard the name and have no idea how to actually use it. So who qualifies? ECHO is for the family members of active duty service members who have a qualifying condition, things like a moderate or severe intellectual disability, a serious physical disability, autism spectrum disorder, or certain other extraordinary medical or psychological conditions. One key thing to know, ECHO is for active duty families. When a sponsor retires, ECHO eligibility generally ends, so this is a benefit to use while you have it. Here's the part that trips families up. Before you can register for ECHO, you generally need to be enrolled in the EFMP, the Exceptional Family Member Program, through your service branch. EFMP and ECHO are two different things that work together. EFMP makes sure your family members' needs are considered when your family gets assignment or relocation orders. ECHO is the one that actually delivers the extra benefits. You need the first to get to the second. Now the benefits. This is where ECHO really matters. Depending on your child's needs, ECHO can help with things like in-home respite care, which gives caregivers a break, applied behavior analysis therapy for children with autism, durable equipment and the training to use it, specialized services and rehabilitation that go beyond what basic TRICARE provides. There's a monthly cost share based on the sponsor's pay grade and a monthly maximum benefit. And because those figures can change, you'll want to confirm the current numbers with your regional contractor. If this already sounds like a lot, you're not wrong. ECHO is case managed. It's registered through your regional TRICARE contractor, and between EFMP enrollment, ECHO registration, finding providers, and keeping authorizations current, it is genuinely a lot for a family to carry, especially while you're also raising a child with complex needs. And that's exactly why we exist. At Precision Pediatric Operations, we help military families navigate the ECHO process, from understanding whether you qualify to getting registered, to managing the authorizations and renewals so your child's services don't lapse. You don't have to figure this maze out alone. And it's not just families. If you're a provider, a pediatric practice, or a therapy center, working with TRICARE and ECHO families, we help on your side too, managing the TRICARE and ECHO authorizations so your patients get approved care without your staff drowning in paperwork. If you think ECHO might be right for your family, or you just want to understand it better, head to our website, precisionpediatricops.com, where we've got more free TRICARE information to help you get started. Or call us at 540-223-4565 for a free consultation. One important note, this is general educational information. ECHO eligibility, benefits, and costs are determined by TRICARE and can change. So always confirm the specifics of your situation with your regional TRICARE contractor or your EFMP office. If this was helpful, like and subscribe, and share it with another military family who might not know ECHO exists. There's a new one every week, and the next one might help someone you know. I'll see you then.